Hello, my name is Amy and I work as a personal coach with the Brady Group. I have the opportunity to work with practices all over the world, and one of the things that we've discovered is everybody seems to have the same challenges. I remember when I worked in the dental practice, we felt like our practice was unique, and it was, and every single one of your practices are unique as well. But people are people, and the challenges are the same. I remember my first international dental practice I had the opportunity to work with, and I was scared to death when I was going to have my very first Skype video chat with them, because I was thinking, how am I going to help these people? I don't even know what it's like in South Africa. And so I just began to ask some questions, and you know what? More new patients, better case acceptance, no-shows, cancellations. They have the same challenges all over the world. And so that's great news because we can help with that. Today I'm going to share just a simple tip with you that is something you can try as soon as you finish this video, which, by the way, I will try and keep very short. But we get in the habit of telling, explaining, educating. Patients come in and it's our job to find things that are wrong and give a solution. That's what you've been trained to do. That's how patients have been brought up, and frankly, that's what they expect. And so that's what we do. But I would like to propose that you try things a little bit differently. Start asking questions. And listening more. In fact, if you can talk much, much less, maybe one of your words to every 4 or 5 of the patient's words. In other words, let them talk about 80% of the time. And the way that's going to happen is by asking questions, open-ended questions specifically. And I'll give you a few ideas. See, again, we're used to bringing a patient in and saying, yeah, here, that's what I see is wrong, and here's what you need to do about it, and here's why you need to do something. And by the way, if you don't do this, here's what's going to happen. And that works fairly well, for crisis dentistry, tooth at a time. But when we are starting to talk about multiple unit, long-term, comprehensive, preventive type treatment, that's a little more difficult. And so you have to be putting the patient at the center of the conversation. And here's how you do that. Patient comes in and you begin to ask questions. Tell me how you'd like us to help you today. Well, I'd like to get my teeth clean. We can do that. Why is it important for you to get your teeth clean? What value do you see in that specifically? Well, I want to keep my teeth healthy. All right, I'm glad you're here. You're in the right place and we can do that. Just so we're on the same page, tell me what healthy means to you. Okay? And so getting in the habit of, instead of trying to drag a patient into your frame of reference, what if you were to go into their frame of reference and get on their level and their understanding? See, we've said horrible things about our patients in the past, like, oh my gosh, they have such a low dental IQ. Well, you know what? No. Problem is you have a low EQ. You have a low, low level of people smarts and the ability to understand and communicate on a level that's appropriate. And so when we try to drag them into the dental realm, we don't do very well. And so I'd like to challenge you to get into their realm and seek to understand them. Because when you do that, you build trust. When they feel heard and understood, they want to know more and they like you. People that feel understood and heard like the people that are listening to them. So just listen more. And in order to listen, you're going to need to ask open-ended questions. What if you were to ask them something like, if we were to look 10, 12 years down the road, what do you want your teeth to be like? And, they're probably going to say something like, gee, I hope I still have them, or healthy. Well, let's explore that a little bit. Tell me what healthy means to you. Well, that I can chew, that nothing hurts. Okay, fair enough. We can certainly help you with that if you'd like to. If we see some things today that maybe aren't necessarily symptomatic, but could potentially pose a problem and get in the way of what you want to happen down the road, how do you want to deal with those things? If we're able to catch those things sooner than later so that, you don't have to experience any pain, and probably will save you some money and unexpected visits here, is that something that you'd like us to help you with? And so begin to ask questions and just seek to understand, because you will build a level of trust that is so strong that when it comes time for you to talk about solutions, patients are going to be much more open. And here's the great news: when they say things like, I'll just do what my insurance covers, you could say, hey, that's an option, and it's wonderful that you've got $1,000 to work with, because a lot of people don't have that. Most see that more as a supplement. And so I know when we talked earlier, you mentioned that, you'd like to prevent unexpected things from coming up. So if there are some of those things that maybe insurance doesn't cover, what do you want to do about that? Again, see how we're giving this back to the patient. We are not taking responsibility for anything. We're not taking responsibility for the condition of their mouth, for their value system, for any of that. Because here's the thing: you cannot create value for your patients. You can't, because you are in your frame of reference with your own value system that's based on your experience, and they have their own value system. But when you begin to talk technical and logical with them, that's not valuable to them. And you can't create that for them, okay? Because that involves education. And patients make decisions emotionally, not rationally. We all make decisions that way. And so you've got to get onto their level and begin to ask questions and find out what is important to them. And then you know what? The solutions are the same. You offer the same solutions you would anyway, but the difference is you have earned the right to offer that solution. And the patient sees the connection between what it is that they want and the solution that you're proposing. So that's just scratching the surface, just a little tidbit. Again, my challenge to you is to leave this video and go into patients today and just start asking some questions. I have a link down below where you can request a list of open-ended questions, and I will shoot you over several that you can try. You can post some on the wall. I'll give you some printables that are fun and easy to look at, just as a reminder. Now, I don't intend for you to memorize those questions, but it'll at least give you a starting point. I would love for you to drape your own words and personality over the concept of open-ended questions, and then begin to ask what's appropriate. So thanks for tuning in. I hope you'll join us next time. And you can always reach me at Amy@Brady Group LLC. If you've got any questions, I'd be happy to answer them for you. See you next time. Bye-bye.